In Shasta County, California, something is bubbling up just beneath the surface. It's a major conflict between the county government and the people who care for its most vulnerable residents, its essential home care workers. And after more than a year of going back and forth, things have hit a wall. So let's break down exactly what's going on and what's really at stake here.
To really understand this, you first have to understand the people at the very heart of it. And this quote from Susan McMains, one of the caregivers, it just nails it. We're talking about people who see their work as so much more than a paycheck. It's a calling. But, that kind of dedication is being seriously tested by their financial reality.
So what we're looking at is a formal labor impasse. That's basically a complete breakdown in negotiations. The question is, who are the workers involved and what exactly led them to this breaking point? First off, let's just look at the scale of this. We're not talking about a small group. There are 4,500 in-home supportive services, or IHSS workers in Shasta County alone. That's a huge workforce dedicated to care. And who do they serve? Well, they directly care for over 4,700 of the county's residents, people who are elderly, people living with disabilities, and veterans. I mean, look at those numbers. They're nearly 1-to-1, which just shows you how absolutely essential this care is for thousands of people to be able to live with dignity in their own homes. And that brings us to the main event. After an entire year sitting at the bargaining table, the union representing these workers has declared a formal impasse. Now, this isn't just a simple disagreement. It's an official move that triggers a state-level intervention.
To really grasp what's at stake, we need to zoom in on the work itself. What does an IHSS caregiver actually do? And why is their role so critical, not just for their clients, but for the entire community?
The job goes way beyond just keeping someone company. These workers perform medical services, they help with personal care, they provide support around the house. And here's the kicker. This work keeps people out of incredibly expensive nursing homes and hospitals, which actually saves the county and the state a ton of money.
So, at the heart of this whole dispute is pay. In Shasta County, these workers earn $18.50 an hour. Now, you might look at that and think, well, it's pretty close to the statewide average. But the union argues that in a field with no benefits, no health insurance, no pay time off, even that small gap makes it incredibly difficult to recruit and keep caregivers. And that's a problem that's only going to get worse.
And as field organizer Jessica Machado points out, this is about way more than just individual workers. It's about maintaining a crucial piece of our healthcare system. When these caregivers can't afford to stay in their jobs, the entire system feels the strain. But how did we get here, to this impasse? It wasn't just a simple failure to agree on a number. The story has a major twist. There was an offer on the table, and then, suddenly, it was taken away. This timeline is absolutely critical to understanding the situation. Okay, so negotiations start in December. By March, the county offers a modest 40-cent raise. They even reaffirm that offer through the summer. But then, get this, on December 19th, just 6 days before Christmas, the Board of Supervisors completely rescinds it, pulls it right off the table. You can imagine how that was received.
So what was the county's official reason for doing that? Well, they pointed to changes in their financial situation, citing things like state funding challenges and federal budget cuts. That was their public explanation for the sudden reversal.
But the union's response was fast and clear. They argue the county never provided a single document to back up this claim, especially since those same financial pressures were there when they confirmed the offer months earlier. So they're not just calling it unfair, they're calling it a violation of state labor law and have filed a formal unfair labor practice charge. Okay, so with both sides dug in and some serious allegations on the table, what happens next? Let's take a look at the formal process that this impasse has now kicked into gear. So what exactly is a labor impasse? It's more than just a big argument. It's a legally defined moment when negotiations have officially failed. And that kicks the problem up to a higher authority to try and find a resolution. And that higher authority is a state-mediated fact-finding panel. It's basically a 3-person team, 1 person from the union, 1 from the county, and a neutral chairperson to break the tie. They'll review all the evidence and then recommend a settlement. The key word here, though, is non-binding. And while that panel gets set up, there's a whole separate process happening at the same time. The California Public Employment Relations Board is going to conduct its own investigation into the union's charge that the county broke the law. And that could take months.
Now, this dispute doesn't just affect the workers and their clients. It could have huge financial consequences for every single taxpayer in Shasta County. Which brings us to the million-dollar question, and I mean that literally. If this isn't resolved, Shasta County could be on the hook for a state penalty of roughly $1 million every year. That's a massive figure that would have to come out of the county's budget.
So how does that happen? Well, remember how I said the panel's recommendation is non-binding? There's a catch. If the panel recommends terms that are better for the workers than what the county is offering, and the Board of Supervisors still refuses to agree, the state can penalize the county by cutting its social services funding.
And that penalty isn't just some abstract number. That million-dollar loss would be a direct cut from funding for essential programs, including the very home care services at the heart of this dispute, as well as things like children's services, foster care, and adoption programs. The fallout could be incredibly widespread. So that leaves us with this massive question hanging in the air. You have workers who feel completely devalued, residents caught in the middle, and this huge financial penalty looming. The fight for a fair wage has really become a question of what the county's priorities are. And you have to wonder, who will ultimately bear the cost of this crisis in care? Will it be the caregivers, their clients, or the entire community?